Welcome to The Explainer. Today, we're taking a seriously fascinating journey across the entire medical field. We're going to synthesize one piece of absolutely vital advice from 20 different medical specialists to uncover the best ways to protect your body. We're talking about top-tier, life-saving knowledge curated directly from the experts who literally spend their entire lives studying, diagnosing, and treating the human body.
It's a pretty incredible question to think about, right? Like, if you had the undivided attention of 20 different medical specialists and you could ask them for their single best piece of advice, what would they actually say? Well, you don't even have to wonder, because this explainer curates exactly that. We're diving into everything from everyday hygiene hacks all the way to life-saving preventative care.
Okay, let's dive into this with Section 1, Everyday Hygiene and Hacks, Upgrading Your Daily Routines.
So let's start with a surprisingly simple laundry hack from OBGYN physician Dr. Danielle Jones. She says you absolutely need to stop throwing out your favorite underwear just because of period stains. Here's the trick. First, give the garment an initial rinse. Next, and honestly, this is the secret sauce here, sprinkle powdered meat tenderizer directly onto the stain. Just let that sit for about 30 minutes and then throw it in the wash as usual. When you take it out, that stain will be completely gone.
Now, I know what you might be thinking. It sounds kind of like magic, right? But it's actually just pure science. You see, powdered meat tenderizers contain an active ingredient called bromelain, which is a proteolytic enzyme. Think about it. On a steak, it chemically breaks down proteins to make that cut of meat way more tender. But on a blood stain, it breaks down those exact same proteins to just pull the stain right out of the fabric.
Moving right along, we're going to rapid fire through 4 incredible daily hacks from 4 very different specialists. First up, from an orthodontist. You've probably been brushing your teeth wrong your entire life by going flat side to side. You actually need to tilt the brush to a 45-degree angle to get right up underneath the gum tissue for 2 minutes. Why? Because that's exactly where the plaque hides. Next, a podiatrist reveals that one of the absolute most effective topical medications for toenail fungus is, get this, just Vicks VapoRub. It contains eucalyptus and menthol, which are naturally antifungal. Pretty wild, right? Third, a plastic surgeon's hack for a natural lip plump. Just mix 1 to 2 drops of food-grade peppermint oil into your lip gloss. It creates this mild tingle that gently plumps your lips. But hey, a quick warning on this one for sure. If your lips start to burn, wipe it off immediately and start over with way less oil. It should tingle, not burn. Finally, a pediatrician's absolute must for cold and flu season, use a nasal aspirator to literally suck the snot out of babies' and toddlers' noses. It clears their mucus, helps them eat and sleep way better, and honestly prevents much worse problems down the line. To really anchor this first section, take a quick moment to absorb this super powerful thought from board-certified dermatologist Dr. Sharina Dress. She compares basic daily skincare to brushing your teeth. I mean, you wouldn't expect a dentist to just fix your teeth if you never actually brush them at home, right? In that exact same way, a solid daily skincare routine is the absolute anchor to any cosmetic procedure you might ever get in an office. You just have to do the daily work.
Right, moving on to Section 2, Busting Common Medical Myths. Stop doing these things immediately. Now, what's really interesting about this is how often we confidently believe things that medical specialists completely disagree with. Let's look at a few. First, family medicine doctors urge us to literally never stick anything smaller than our elbow into our ear. Using Q-tips doesn't actually clean your ear at all. It just packs the wax deeper, damages the delicate skin, and seriously risks a nasty infection. Second, ophthalmologists want to confirm once and for all that a lost contact lens absolutely cannot migrate into your brain. No way. You have tissue layers that physically prevent anything from moving back there. If it's lost, it's just stuck under your eyelid. Finally, urologists are completely debunking that old 8 glasses of water a day rule. That myth actually comes from a 1945 recommendation that totally ignored the fact that most of our fluids come from prepared foods. The actual reality? Just drink when you're thirsty, or, a bit more if you're exercising or out in the heat. The ultimate trick is really just to look at your urine. If it's a light yellow color, kind of like lemonade, you are perfectly hydrated.
Up next is Section 3, Physical Mechanics and Pain. How the body moves, bears weight, and heals. 4 pounds. That is an incredibly important number. Orthopedic spine surgeon Dr. Antonio Webb warns that keeping your body weight down is absolutely crucial for preventing back pain. But why? Because every single pound of extra body weight adds 4 additional pounds of pressure directly across your spinal discs. So let's put that into perspective. If you carry just 20 extra pounds of weight, that is 80 extra pounds of force constantly wearing down your spine every single day, causing arthritis, degeneration, and eventually severe pain.
And speaking of the spine, listen to this really great posture guide from board-certified anesthesiologist Dr. John Patton. If you're pregnant and you want a labor epidural, getting into the proper position while you're actually having contractions is just extremely important. You need to put your head down, drop your shoulders, and curve your back into a C shape. He vividly describes it as curling up like a shrimp or like an angry cat. This specific mechanical shape physically opens up the spaces between the spinous processes in your back, which is exactly what allows the doctor to safely place that epidural needle.
Now, if you ever suffer a new musculoskeletal injury, like a sprained ankle, sports medicine Dr. Brian Sutter has a highly practical tip for you. To reduce that swelling and inflammation, you can totally skip those stiff, uncomfortable ice packs and just use a bag of frozen vegetables, like peas or corn. Because the vegetables are small and loose inside the bag, it actually conforms perfectly to the unique shape of your joint to provide really even cooling. Just throw it back in the freezer when you're done, but hey, whatever you do, definitely do not eat it afterwards.
So, the crucial point as we move into Section 4 is internal health and prevention, life-saving preventative measures.
Let's start with how to navigate the hospital itself. Emergency room doctors strongly advise that if you ever end up in the ER, you absolutely must bring a list of your medications, any past diagnoses, and the dates of significant operations. Oh, and bring a phone charger, because let's be real, you're probably going to be waiting a while. Furthermore, if you are getting imaging done, a diagnostic radiologist wants you to know one major secret. They see absolutely everything. I mean everything. If you swallowed a chicken bone, they see it. If you put something somewhere else, well, they're going to see that too. There are literally no secrets on an X-ray.
Moving on to your internal systems, here is some wonderfully simple, life-saving math from General Surgeon Dr. Karan. The single most underrated life hack for bowel health is honestly just eating more fiber. Check this out. Increasing your fiber intake by just 10 grams a day reduces your colon cancer risk by 10%. And 10 grams of fiber is incredibly easy to get. It's literally just a banana and 2 slices of bread. This ties perfectly into some great advice from gastroenterologist Dr. Austin Chang, who reminds us that colorectal cancer is often entirely preventable through a routine colonoscopy. By just looking inside the colon, doctors can physically find precancerous growths and just snip them out before they ever even turn into cancer.
When it comes to your heart and lungs, here are 2 really vital facts. First up, a cardiologist advises you to track your blood pressure and your resting heart rate. As you exercise regularly, you can actually watch your resting heart rate come down over time. This is critical because a lower resting heart rate directly correlates with a longer, healthier life. Second, a pulmonary critical care specialist has one absolute non-negotiable rule. Pay attention to what you put in your mouth. Do not smoke or vape anything, period. Whether it's a cigarette, a vape pen, or marijuana, it is absolutely going to cause some degree of inflammation in your lungs. That is a 100% guarantee, regardless of what anyone else tries to tell you.
Finally, let's look at Section 5, holistic care and impact, mental health and saving others.
I really want to slow the pace down for just a second here to reflect on this excellent advice from psychiatrist Dr. Jessie Gold. She actually calls herself a feelings specialist. She urges us to take time every single day to just ask ourselves how we are doing. As Dr. Gold says, feelings are not inherently good or bad, they're just feelings. We really have to stop judging them and just give ourselves the grace and the space to acknowledge them and deal with them. She points out that literally everyone can benefit from therapy, and we shouldn't just view it as something to do only when we have a massive life crisis. Instead, we can use therapy proactively as a tool to simply make ourselves better, healthier people in all aspects of our lives.
And this brilliantly illustrates our final medical tip, which comes from hematologist Dr. Sanjay Junja. His plea is incredibly simple but profoundly impactful. Please register for bone marrow transplants. Right now, there are people suffering from blood disorders and leukemia who sadly have a very short amount of time left to live. They are just out there hoping and praying that some random person in the world simply swabs their mouth, sends it in, and just happens to be the exact match they desperately need. Think about that for a second. A simple 5-minute swab from you could literally give a cancer patient their entire life back. It's truly incredible.
Wow. We've just absorbed the collective wisdom of 20 different medical specialists. We've looked at everything from how meat tenderizer basically dissolves bloodstains, all the way to the life-saving math of simple dietary fiber. But just absorbing this advice is really only the first step. I want to leave you with this final provocative question. Out of all the expert advice we just covered, what is the one single health habit you are going to actively change today? Thank you so much for joining me for this explainer, and as always, stay curious and stay healthy.